I've got to say something. I'm heartened by the fact that after 4 years, you finally heard at least some presentation of alternative payment methodologies. But I'm also saddened, and on behalf not only of our members, but of those prior speakers, that it has taken 4 years for this board to hear those presentations and to begin some discussion. 4 years in which members' benefits, their co-pays, their deductibles, their out-of-pocket expenses have drastically increased. And as you've seen on the chart today, when Caroline showed our enrollment process, many now, for this coming year, a 300% increase in the number of members who are going to get hit with wellness surcharges. Folks, that is wrong. That is wrong. So, I think you have two choices today. Your first choice, we can keep on doing the same old that we've been doing. You've seen proposals to further erode the benefits. You can vote for that. You can adopt those proposals. And you're violating your bylaws and your fiduciary responsibility as outlined in those bylaws to operate this plan for the benefit of the members and their beneficiaries, solely for their benefit. Solely for their benefit. Those are the words. Now, you're also, notice where you're putting in the added expenses of members are on the, quote, lower value plans. When we've been told that CDHP is the plan every member should go to. There's a contradiction in philosophy to that. It contradicts the message that's been given. We propose that you chart a new course today. Pending these studies and implementation of other alternative payment methodologies, we suggest that you go to the General Assembly, this board, along with the staff, along with the employee associations, and negotiate with them to save $250 million per year by linking hospital reimbursement rates to Medicare plus some additional percentage to be negotiated out to save that money that needs to be saved. Request the General Assembly to allow the state health plan to spend down reserves below that 20% so that we can enter either contract or enter the negotiations to get those costs down. I think you would find if you tell the General Assembly we can save $250 million per year, that will allow us to get the 10, 15 million or whatever in order to hire the staff we need to do that. And finally, negotiate those contracts as needed, and let's begin to get that implemented as an interim strategy. In closing, I want to urge you to delay voting on this issue today. And vote and advocate a better health plan for state employees and those who serve as citizens of the state of North Carolina. And that means whether they work in the prison system, protecting us from sexual predators, clearing the highways so that private utility companies can get their crews out there to restore energy like we saw in the recent snowstorm, caring for our mentally ill and developmentally disabled, protecting the public health and public safety, or providing an educated workforce so we can attract jobs to this state, whether it be in the public schools, community colleges, or university system. But please, delay this vote, go and negotiate with the General Assembly. Thank you.